Hi, I'm Dr. Ritakshi. Welcome back to my channel. Today I'm going to be talking about gastritis. Gastritis is a common condition that affects millions of people worldwide. Now, it's an inflammation of the lining of the stomach, and that can cause a lot of uncomfortable symptoms. So in this video, I'll discuss about the causes and how to manage gastritis through diet and what foods we should eat and what foods we should avoid. In our digestive system, the stomach plays an important role as it helps break down our food. The stomach is covered with a layer of mucus, which helps protect it from the digestive juices that is produced to break down this food. However, if this protective layer gets damaged, then the lining of our stomach becomes inflamed, red, and this causes gastritis. Gastritis can have a range of symptoms. Now, these would include feeling pain in your upper abdomen. Now, this is usually a burning sensation or annoying pain. You can have feeling of nausea and vomiting. There's feeling of fullness right after you eat. There's also heartburn that can come. And there's also a loss of appetite and feeling of indigestion. Now let's look at some of the causes or risk factors of gastritis. Gastritis is usually of two kinds. It could be acute or it could be chronic. Now, some of the risk factors or causes of gastritis would include, first is a regular use of non-steroidal anti-inflammatory drugs. Now, people are usually taking this on a regular basis, and these usually include your ibuprofen or your aspirin. So if you're taking these drugs for a longer period of time, then it would lead to chronic gastritis. Another cause of gastritis is an infection with H. pylori bacteria or Helicobacter pylori bacteria. So what H. pylori does is that it destroys the mucus lining of our stomach, and it also destroys the acid-making cells that help us break down our food. So it becomes harder to digest proteins and other foods, and it also is hard to kill the bacteria or the microbe that is present in our stomach. And this could lead to our third risk factor, which is food poisoning. Now, if you have exposure to bacteria, you're bound to have food poisoning as well. Another cause of gastritis is usually chronic use of tobacco and alcohol, especially alcohol. Now, there's also such thing as called alcoholic gastritis, and alcohol has a very direct effect on our digestive system, so it's best to avoid alcohol. Next risk factor is stress and anxiety, and also another risk factor or cause of gastritis is if you have another condition such as autoimmune conditions or other diseases, and then also you might be taking some medications or even taking these NSAIDs and steroids. To manage gastritis, we have to make sure that we get a relief from these flare-ups and that we don't get these heartburns and this pain, and these things are all very uncomfortable. So we have to make sure that there is no burning sensation or no bloating, no indigestion. Now, how do we achieve that? Making some dietary changes can actually help in maintaining these symptoms and managing these symptoms. First is to avoid large meals. Now, it's best to eat smaller amount of meal in every meal you take, and sometimes taking frequent meals is usually also helpful, especially if you have that burning sensation. And usually when you eat, the sensation and the pain usually goes down. Now, it's also best to eat less food because this also puts less stress on your stomach and your symptoms will not be as active. So we have to give it less time with food in our stomach so that the lining of the stomach gets enough time to heal itself. Now, also that something that is found to be helpful is usually intermittent fasting. It's also because of this reason that you have a small period of time when you can eat and larger amount of time when you are just on fasting. Now this usually works for patients who feel okay with not eating for a long period of time, but some patients have relief from eating. Second dietary change that we can make is we can cook our food in a different way. Now we don't have to fry everything, we don't have to grill everything. We can use some gentler cooking methods such as boiling, steaming. We can also choose a diet that's anti-inflammatory, that will help us reduce the inflammation in our body and also in the lining of our stomach. So let's talk about some foods that we should have if we have gastritis. We should choose complex carbohydrates. Now, complex carbohydrates are usually helpful as they regulate our blood sugar levels and also they reduce the level of inflammation in our stomach. Some examples of complex carbohydrates include brown rice, whole grains, quinoa, sweet potatoes, oats, oatmeal. In gastritis, we must include a diet that's full of vegetables and fruits. Now, in gastritis, it's best to have low acidic foods. Some examples of low acidic vegetables include cabbage, broccoli, Brussels sprouts, also includes carrots, sweet potatoes, cucumbers. Some examples of low acidic fruits would include berries such as strawberries, blueberries. There's also apples. You can also include bananas. Next is to have probiotics or probiotic rich foods. Now, probiotics usually promote a healthy microbe in our gut, and it also helps in reducing inflammation in our gut. Some examples of probiotics food would include sauerkraut, kimchi, kombucha, and kefir. We can also have dosa, idlis, all the fermented foods, and we can also include yogurt. In gastritis, we must focus on lean proteins. Now, lean proteins would come from lean poultry, such as chicken and turkey, and we can also have some fish. So we should opt for low-fat foods, and these would also include low-fat dairy products and low-fat dairy, or we can even have fat-free dairy products. So these would include low-fat milk, low-fat cheese, low-fat yogurt. In gastritis, it's also important to follow an anti-inflammatory diet. Now, for anti-inflammatory, we can have foods that are rich in omega-3 fatty acids, vitamin C, and zinc. Now, we should also take into consideration including foods that have anti-inflammatory properties. Now, first being ginger. Ginger usually has antibacterial properties, and it also helps reduce inflammation. It gives you relief from constipation, bloating, and also gives you relief from the feeling of nausea. Second is peppermint. Now, peppermint has properties such as it helps us relieve stress, and it also reduces inflammation. It also helps with pain. Next is turmeric. Now, turmeric also has anti-inflammatory properties. It also has antibacterial properties. It also helps heal wounds, and it also relieves pain. Next is to drink plenty of water. It's very important to stay hydrated, and this will also help you get rid of all the toxins from your body. Now let's quickly go through the list of foods that we should avoid or limit. First, we should avoid coffee. Now, the caffeine that is contained in coffee can actually produce more acid in our stomach, and this would flare up the symptoms of gastritis. Next is we should avoid spicy foods. Now, spicy foods will also flare up the symptoms of gastritis. Next is alcohol. Now we should avoid alcohol at all costs, because alcohol consumption can also cause alcoholic gastritis, which can lead to more irritation of your stomach lining, and it could also finally lead to ulcers. And alcohol is also made up of other things such as sugars, carbohydrates, and wheat or barley or some sort of carbohydrate, and these would also increase your chances of inflammation, and then you'll have more sensation of burning, more nausea feeling, and more distension and bloating. We should avoid high-fat foods. Now, high-fat foods are known to increase inflammation in our body and especially in our digestive system. So these high-fat foods would include meats such as red meats, processed meats such as sausages, packaged foods like your chips, and packaged snacks and other baked items. This would also include fried foods. We should avoid fried foods. We should also avoid acidic foods. Acidic foods such as acidic fruits and vegetables would include tomatoes, chilies. It would also include onions, and sometimes it's also noticed that some gastritis patients cannot have citrus fruits, even though there is vitamin C, but citrus fruits are also in category of acidic foods. We should also avoid consumption of refined foods and refined flour. Now, in some cases, if there are other underlying causes of gastritis, and there are other conditions like celiac disease, inflammation of your stomach, other autoimmune diseases, or you have some lactose intolerance or other food allergies or food intolerances, then we should make sure that we avoid those kinds of foods. Like you can avoid gluten, fructose, lactose. In addition to dietary changes, we can also have some lifestyle modifications that can help us manage our symptoms of gastritis. The first one would be to avoid regular use of NSAIDs or non-steroid anti-inflammatory drugs. Now, these are only meant to be taken regularly if your doctor or your healthcare provider has told you. We should try to reduce stress levels in our life. Now, we must reduce anxiety and stress, and these could be managed by regular exercise. You can do meditation, you can opt for yoga, or you can have some time for your hobbies. These would all reduce stress, and stress has a very big effect on managing your symptoms of gastritis. We must make sure that we get good amount of sleep. Now, enough sleep is important for your body to rejuvenate itself and restore its proper functions, and your stomach will also be at ease when you're sleeping and could reduce the inflammation. We must practice good hygiene. Now, we must make sure that we stay away from infections and we eat properly cooked foods, and we must stay away from infections like H. pylori infection, and these can also cause you food poisoning. In conclusion, managing gastritis through diet is possible if we make very small changes in the way we eat, what we eat, and how we eat our food. So eating small and frequent meals, avoiding foods that irritate the lining of our stomach, incorporating foods that are rich in anti-inflammatory properties and antioxidants, and also adding in some probiotic rich foods. We must also avoid having alcohol. We must stay hydrated, have a stress-free life, and include exercise and some meditation. Making such dietary changes and lifestyle changes are very important in treating and managing gastritis. However, sometimes it is not enough to have these and to fully treat gastritis. So we must also learn and know about the underlying cause of gastritis. So we must always talk to our doctors, our healthcare providers, to understand where this gastritis is coming from, if we have any other conditions or diseases or even autoimmune disease that is causing this gastritis, and then we must take steps to treat and manage the underlying cause. Thank you for watching this video on gastritis. I hope that you found this information helpful in learning more about this very common condition that a lot of people are affected by worldwide, and to learning more about its causes, its risk factors, and how to manage gastritis with diets. If you found this video helpful, and if you like this video, please make sure to like the video and share it with others who might find it helpful. Don't forget to subscribe to my channel for more videos on nutrition and health like these, and don't forget to press the bell notification button so you know whenever I post a video next. Thank you for joining in. I'll see you in the next one. Bye.